Hey guys, Dr. Mark Dailey. Today we are going to attempt to answer the question, why me? Why is it that I have fibromyalgia and my neighbor doesn't? Well, as you probably know, fibromyalgia is a complex and poorly understood chronic pain condition, and its exact cause is not fully known. I believe that fibromyalgia is likely the result of a combination of genetic, environmental, and physiological factors. I'm going to share some key factors that may contribute to the development of fibromyalgia. So we're going to start with genetic predisposition. There appears to be a genetic component to fibromyalgia as it tends to run in families. If you have close relatives with fibromyalgia, you may have a higher risk of developing the condition. Then there's central sensitization. Now, I did two videos on this. I'll leave a link in the bottom of the description. One of the leading theories behind fibromyalgia is central sensitization. This is a condition in which the central nervous system becomes hypersensitive, amplifying pain signals from various parts of the body. It's believed that some individuals may have a genetic predisposition to central sensitization. Then there's trauma or physical stress. uh, Physical trauma like a car accident or injuries and emotional stress may trigger the onset of fibromyalgia or exacerbate the symptoms in some individuals. Trauma can potentially contribute to the development of central sensitization. Now, I have no doubt that some of you listening recognize the onset of fibromyalgia started after a physical trauma, whether it was a car accident or something like that. And truly, my experience tells me that the accident or the physical trauma was the straw that broke the camel's back. In other words, you had some issues that were underlying, hadn't yet made their way to the surface, but yet that physical trauma was enough to push you over the edge. And then there's infections. In some cases, viral or bacterial infections have been associated with the onset of fibromyalgia symptoms. It's thought that these infections may trigger an abnormal immune response or affect the nervous system adversely. Then there are sleep disturbances. Many people with fibromyalgia experience sleep disturbances, including problems with deep restorative sleep. Poor sleep quality can worsen pain perception and may also be a contributing factor to the condition. Then there are hormonal factors. Hormone imbalances, particularly in women, have been linked to fibromyalgia. Fluctuations in hormone levels, such as those that occur during menopause, may influence pain perception. Psychological factors like stress, anxiety, and depression are common in individuals with fibromyalgia. Now, while these conditions may not cause fibromyalgia directly, they can exacerbate its symptoms and may make them more challenging to manage. Now, it's important to note that fibromyalgia is a diagnosis of exclusion, meaning that other medical conditions with similar symptoms must be ruled out before a fibromyalgia diagnosis is made. Now, if you believe you have fibromyalgia or have been diagnosed with it, it's crucial to work closely with a functional medicine provider to develop a personalized treatment plan that may include medications, lifestyle changes, and therapies to manage symptoms and improve your quality of life. Now, let me be clear here that fibromyalgia is never the result of one single issue. Over the course of the last 15 or 16 years, I've worked with hundreds of fibromyalgia patients, and I always see multiple layers of dysfunction. And I'll say that the gastrointestinal system seems to always be at the root of the problem. Now, keep in mind that 70 to 80% of your immune system is housed in your gut. So when I treat a fibromyalgia sufferer, I look for all the other things that I mentioned earlier when I'm performing a complete health history or reviewing a metabolic assessment form or analyzing the advanced laboratory testing. And that is what it takes to unravel the multiple layers of dysfunction that a fibromyalgia sufferer is dealing with. I will tell you, however, it is possible to regain your health and get your life back. to stop the daily struggle of simply getting through the day's activities. So, in my experience, women that have suffered literally 30 years with fibromyalgia have had amazing recoveries within as little as 90 days. But you have to find out what the core issues are and then remove those. Allow your body to do what it does best, which is heal itself. Now, if I can be of any help to you, please reach out to me. You're welcome to call the clinic. I'll leave the number here. I work directly with patients all over the country. We talk on the telephone. We can do a Zoom meeting to see if perhaps I might be of help to you. But I do want to thank you for your time and attention. God bless you and have a wonderful day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.